Welcome to the Dental Decoders podcast. I'm your host, Brittany Rogars, and I'm here to help you crack the code on all things dental operations. Each week, we dive into topics to help you overcome roadblocks, streamline operations, and reduce team burnout. Whether you're an owner, a practice manager, or a team member, this podcast is for you. Join us for insightful discussions, engaging interviews, and practical tips. So sit back and relax as we crack the code on all things dental operations together. Good morning, Decoders. Welcome to this week's episode where I am interviewing Susan Cotten. This episode took me way outside of my comfort zone as someone who is in the dental industry on more of an admin side. I've been getting a lot of requests to bring in some people about how we can improve operations from the clinical side as well. So I went out and I found Susan. Susan is just an absolute wealth of knowledge. And we talk about all things oral cancer and oral cancer screenings in this episode. So Susan is a hygienist and also the CEO of Oral Cancer Consulting. She has her own method called the Cotten Method, which is a comprehensive oral cancer screening method and dental oral cancer office system. So not only is it the way that we screen, but how we implement that inside our practice, which I think is just amazing. A lot of offices are really great at saying, let's do this thing, but then they don't have an implementation plan in place and it kind of lasts for like a week or two and then it falls by the wayside. So Susan has developed the Cotten Method, which will help not only with the oral cancer screening, but also with the implementation and the long-term effects of that inside your practice. Throughout her speaking, training, and hands-on screening workshops, Susan has worked with dental professionals and dental teams who want to have more confidence in a comprehensive screening, reduce the risk of liability, and increase early detection. In her career, Susan's performed over 60,000 oral cancer screenings and organized countless free screening events, including the Denver Broncos Health and Wellness Expo. She volunteered with a head and neck oncology surgeon, providing free head and neck exams and screenings to the homeless. In addition, she's heavily involved inside the dental community and is the go-to person for all things oral cancer. And she works even on the board for the Oral Cancer Foundation. Susan is a 2018 recipient of the Sunstar RDH Award of Distinction, along with many other distinctions, including the Outstanding Volunteer from the Oral Cancer Foundation in 2023. She also won Dentistry's Got Talent. Outside of all things oral cancer and dentistry, Susan also loves walking the beach in Hawaii and was a former competitive dancer. I'm so excited for you to check out this episode. We're going to put links to everything in the show notes for you so you can find out how to implement all these things and get access to the Cotten Method. And I hope that this episode is as impactful for you as it was for me. As someone who is not on the clinical side of dentistry, it really was eye-opening to get this perspective and learn about how we can help our patients and optimize at the same time. Hi, Susan. Thank you so much for jumping on the call with us. I'm so excited to have you on the Dental Decoders podcast. Thank you for being here.
Well, hi, Brittany. Thank you for having me on. I'm excited to be here. Thank you.
Hi. Yeah. So traditionally with Dental Decoders, our whole theme is how to crack the code on dental operations. And we've very traditionally focused on how to handle that from very specifically like administrative sides of the practice. So I was very excited to have you on so we can talk about how systemization and protocols can help not just the front desk teams or the leadership teams, but also how that can branch out into clinical to provide better experiences for our patients. So without giving away the whole secret recipe here, I would love for you to tell us, our listeners, a little bit more about yourself and who you are, Susan.
Thank you. I'm a dental hygienist, registered dental hygienist here in Colorado. I graduated from University of Colorado School of Dental Medicine, their Department of Dental Hygiene in 1994. And I've practiced both in public health as an integrative dental hygienist here in Colorado. So I worked in the dental clinic and I worked in the medical end as well, providing screenings for the medical providers' patients. And I worked in private practice. What got me here in oral cancer, Brittany, was
Mhm.
in 2008 when I was in private practice. We had a new patient to our office, and she had previously been diagnosed with HPV oropharyngeal cancer and HPV cervical cancer. And in 2008, I said, "What is HPV oropharyngeal cancer?" We were really just on the cusp of starting to hear about that in dentistry. It had been around, but we were just starting to talk about it and learn about it. And this new patient to our office, I got to be her dental hygienist. And I saw the devastation that this cancer did to her mouth and her teeth. But it was about 2 years later, she came in for her 3-month appointment with me. We were catching up, going over health history, and she started to cry. And she said, "Susan, I'm going to a good friend's wedding this weekend. And all I want to be able to do is to go and laugh out loud and smile and take pictures like everybody else. I just want to be able to smile without the constant fear somebody will see what my teeth look like." And at that moment, I realized I knew what the cancer had done to her mouth, but I didn't know what it had done to her entire life.
Mm.
And at that time, as a clinical dental hygienist, I always, quote, screened, but I wasn't always thorough and I wasn't always confident. And I would let the busyness of my day, a late patient, or the perception that somebody wasn't at risk get in the way of performing that comprehensive screening. So I had to go back to what I was doing right out of hygiene school, that comprehensive screening, every patient, every time. But what I discovered was I wasn't confident. Am I palpating correctly? Am I in the right place for the thyroid? What about the oral pharynx and HPV? How do I look at the oral pharynx? So I found the Oral Cancer Foundation. I got involved with them. And Brian Hill has been one of my longtime mentors. And I worked with a head and neck oncology surgeon here and ENTs. And because I needed to know more and I needed to do better. And so, what I discovered as a clinical hygienist, there were 4 key things that I needed to know, and that was the etiologies of oral and oropharyngeal cancer. I knew tobacco and alcohol, but I didn't know about HPV. So, we need to have a solid knowledge of those etiologies. And then there's additional risk factors. And so I need to know about those. And then what we know now, there's signs and symptoms associated with oral and oropharyngeal cancer that we need to ask our patients about. And then being confident and thorough in that comprehensive visual, tactile, extraoral, intraoral evaluation. And so that's what I call the 4 science-based pillars in the Cotten Method. And that's how it came about, was what I needed as a clinical hygienist. And it was my patient who really pushed me forward. And that's why I'm here doing what I'm doing now.
That is an incredible story. And I love that one of the common themes in dentistry, and one of the reasons why I love this industry so much, is everybody's story about why they started their business or why they do what they do is because they had that one patient or they had those couple of patients. And it just warms my heart every time that they're just such kind-hearted people in this industry that they take that one patient and it sparked this huge movement, so to speak. So I would like it if you would tell me a little bit about what it was like as you were starting to develop this Cotten method and as you were starting to implement it. What did that look like for you? And what have you seen that look like for other offices who may be curious about the Cotten method and using some of those tools in their practice?
Yeah. So, what it looked like for me clinically was where I had to start and how I had to implement it, because we're pressed for time as clinicians. And so I had to become confident so I could be efficient and thorough. And so, what else I do in what I call the oral cancer screening is I am evaluating for airway. I am evaluating for myofunctional disorders. When I'm in the mouth, I'm looking at restorative things. I'm doing my assessments on the tissue. Is there inflammation? Is it generalized? Is it localized? So implementing that comprehensive screening, I'm doing a lot of other things as well. And for our office at the time, it was getting everybody on board doing the same thing. And the offices I work with, this is what we discover. Everybody says they're doing an oral cancer screening, but we're not all doing the same thing. And so it's critical for continuity of care to those patients and for early detection that the hygienists and dentists are doing the same thing when they're doing the oral cancer screening. And so I want to say something about that. It's not that we do it in the same order because everybody has their own flow, but it's making sure that everybody's screening the same structures and asking those same questions about signs and symptoms. And so having a team training and a team meeting and making sure that everybody's on the same page with what structures they're screening and how they're palpating, all of those things. And so that's implementing, is having that team meeting, just like we do everything else, discussing it, getting everybody on the same page.
Thank you for sharing that. I know implementation is a piece that we get asked about a lot. If the office is going to listen to this episode and take something away to put into their practice, how do they implement it and how does that look? So team training is a great option. Now, one of the things that we were kind of chatting about before we went on cam was on documentation. How do we make sure that we're documenting that consistently? What pieces are we documenting? I'm a software nerd, so I love being able to use those resources to my advantage. But what are some things that you find are traditionally missing from documentation and practices that they could implement or put into those notes to make sure that one, we're all doing the same thing, and two, make sure that our documentation is solid?
Yeah, good question. So documentation typically and historically, and we still see this, is OCS, oral cancer screening, with a dash, either negative or WNL within normal limits, or some say we never look. But does that really tell us what we've done? It doesn't. And so both ADA and ADHA in their oral cancer policies say that dentists and dental hygienists should screen for oral and oral pharyngeal cancer. They're considered two separate cancers, and really any abnormality of the head and neck. And so does OCS, oral cancer screening, say that we've screened the oropharynx? It doesn't. And so I encourage offices, I like to say comprehensive visual and tactile extraoral, intraoral evaluation. I love templates. I bet you love templates, right? Because the less writing we do, if we can just check boxes and have it there. So that's one thing that can be said, a comprehensive visual tactile extraoral, intraoral evaluation, and then list all of the structures that were screened extraorally and intraorally. That includes tonsil grade, Mallampati score, and then asking those pertinent questions. And you can check those. Do they have a persistent sore throat, a persistent cough? And actually, I have a template that we can somehow get to all the listeners, and they can look at it. They can use it in its entirety or partial if they want, but it's everything that is in a comprehensive screening, and put that in there. And that says what you've done, right? So if there was any litigation, I'm not a lawyer and I'm not giving legal advice, but if you did go into litigation, oh, Susan, I see. Oh, you did palpate the floor of the mouth. Oh, you did look at that oral pharynx and those palatine tonsils, all of those different things. So have that in there. After you've done it, you can mark that you've done it. And then have a comprehensive template for any findings as well.
Awesome. Thank you. And thank you for sharing that resource with us. I think that's going to be super valuable. I'll make sure that gets into the show notes so anybody listening can take advantage of that template. And implement some new tools into the practice.
Yeah, it's just like anything that we do clinically, we want to have a thorough documentation of it. So same with this life-saving screening that we do.
Life-saving screening. I think that is the snippet from the episode, because I think it does get so frequently passed over. I know I get my teeth cleaned every 6 months. I am at the dentist pretty regularly as a dental professional. I can count the number of times on one hand that I've had an oral cancer screening and known that that's what they were doing. So I think that's very important to have that remembrance in there, that it is a life-saving screening. If anybody's listening to this episode and they want to learn more about the Cotten Method, or they want to work with you, or they want to try and implement some of these things in their practice, how do they find you? What does working with you look like? What does all of that entail?
So they can find me on social media, LinkedIn, Facebook, Instagram, my email, oralcancerconsulting@gmail.com. Reach out to me. And what does it look like working with me in an office or a DSO? We look at first what's being done and where does the focus need to be. We look at documentation, we look at referral systems, we get the team together. What do we know about screening? And I believe screening is a team effort as well. And having the dental assistant and the front office involved is critical as well, to learn about the signs and symptoms and those different things. And then we get the dental professionals, the dentists and the hygienists together, and we go over what is that comprehensive screening. I have instructional screening videos that we look at, and we dive into those. They can ask questions, and then we work hands-on. So across the United States, I've spoken at many dental and dental hygiene meetings, doing a presentation and hands-on screening workshops, which is really where mastery is learned. We can hear the information, we can watch the screening videos, but it's then taking that and moving hands-on and developing that mastery. So again, we can be thorough and efficient.
Fantastic. I saw when I was going through your bio that you have been able to do some pretty amazing events, even working with the Denver Broncos. So just for funsies, if you want to tell me just a little bit about that, I want to hear about that a little bit more personally, and then we'll ask you our final question.
So pre-COVID, the Denver Broncos, I'm here a little bit north of Denver, and pre-COVID, the Denver Broncos had a health and wellness expo every year. It's usually Labor Day, and just all at the Broncos Stadium, a lot of different things going on. And so I organized the free oral cancer screenings for that event. And support from that for me was from the Oral Cancer Foundation through different things. So we offered free oral cancer screenings at the event, and dentists and hygienists from the area would volunteer. And it was typically a 2-day event, and we screened a lot of patients. But attendees there. But what was key in doing that was getting the dentists and hygienists who were coming to volunteer on the same page. So we were all screening this, doing the same thing when those people came to our booth. And yeah, that was fun. It hasn't picked up, after COVID. Maybe they will again, and hopefully get to do that again. But that was fun.
That's such an amazing opportunity to give back to the community. I love that. And if you're able to take dentists and hygienists from different practices and different office flows and get them all on the same page to coordinate for an event like that, where they don't normally work together, that really speaks to the implementation that you've got going on. So I think that's just a spectacular little piece that we were able to add in there too. So Susan, I ask, as we start to wrap every episode, I ask one signature question to all of our guests. And that is, what was your secret code or decoding moment in your life that helped you streamline and be successful inside your career? So if you had to sum it up to one tip or one code that you could share with our listeners, what would that be?
Seek excellence in dentistry. In dentistry, we tend to be perfectionists. And that's all areas. But I know as a clinician, if we're 1 or 2 millimeters off, whether it be restorative work or in periodontal charting, things like that, that can be a big difference for a patient. So we really push ourselves to be perfectionists, and there is no perfection. So when I give my courses at the beginning, I said, I want you to strive for excellence. Forget about perfection, because that's a lie. Let's strive for excellence, especially in oral cancer and saving lives. And, my dad was a veterinarian, and I worked for him for a long time. And yeah, even doing dog and cat dentals. But he said they call it practicing medicine for a reason, because we're practicing. He said we don't know it all, and there is no perfection. So always seek excellence in serving your patients and for yourself. And don't beat yourself up if you're not perfect, because we just aren't.
That is so beautiful. And I think that applies in dentistry. It applies in life. There's not any person out there that can't take that piece and apply it to themselves. So I think that's wonderful. I'm going to hang that up somewhere, because as a perfectionist myself, I need to remember that I'm never going to hit that goal. But excellence is something I can do. Oh, Susan, this has been such an enlightening conversation. I am so excited for our listeners to be able to take this and implement it into their practice. I'm so excited to be able to connect our listeners with you and have, like I said, this kind of new angle at this episode where we're able to explore more of a clinical side and how having the systems and operations in place on that side can make a huge difference in your practice. So thank you so much for joining us today. And I can't wait to hear and see all the things that you're up to in the future.
Yeah, thank you, Brittany. If I can add one last thing, what's so important about these systems in oral cancer, in February, there was a dentist in Pennsylvania who had an $11 million judgment against them in oral cancer.
Wow.
So not having these systems in place, while we don't get paid, this isn't a high production thing, it can definitely take things from you in your dental practice or your DSO. And so liability is huge in this area. And so think about that when you're looking at your systems and everything in oral cancer.
Wow, it's almost, you can't afford not to implement these things into your practice. Yeah, that's a great, I'm really glad that you threw that in at the end, because that's a whole different shift of perspective. And yeah, it's not a high producing piece. And I know that that's what's trending right now, is to try and increase production. But why are we here, and can we afford not to do these important steps? So thank you, Susan.
Yep. Protect your license and save a life.
Can't ask for anything better than that. Thank you again, Susan. Thank you so much for joining us for this week's episode of Dental Decoders podcast. We hope you took away a valuable piece of information. As always, don't forget to rate, share, and subscribe to help us build our community of dental decoders. We look forward to seeing you for next week's episode.